Okay, it's live.
We're here to have a formal debate on the competing models of the medical versus the psychosocial behavioral model. A multitude of variables can be examined when diagnosing an individual with autism spectrum disorder. An individual's mental state and behavior in the context of biological, genetic, and environmental factors may result in maladaptive behaviors that hinder individuals making progress or accessing reinforcement. Professionals across various medical and psychosocial/behavioral fields differ on how to treat the problem, and professional and ethical dilemmas arise across these fields as well. We have two different teams. The medical model consists of Audrey,
Hi.
the con prover/attacker, and Jill,
Hello.
the con stater. And then the psychosocial/behavioral team consists of Holly,
Hi.
the pro prover/attacker, and Deanna, who's me, the pro stater. So to begin with, we're going to talk about the psychosocial theory. A paramount person in the psychosocial theory was Erik Erikson. He broke off from Freud's psychoanalytic theory, which made him be considered a neo-Freudian. Erik Erikson is responsible for the development of the 8 psychosocial stages. His theory is a simple explanation in which a person is in a developmental stage and the next developmental stage is forced upon the person due to the social changes and demands of the environment, regardless of where the child is in their developmental process. Either a person has resolved the crisis that they're in that stage of life, or they haven't, and that's why he or she is having behavioral problems. So for the behavioral model, according to Cooper, Heron, and Heward, 2007, the behavioral model is based on the 3-term contingency, antecedent, behavior, and consequence. Behavior is maintained by the consequences that follow it. Reinforcement increases the likelihood that behavior will occur again in the future, and punishment and a punishing consequence following a behavior will decrease the likelihood that behavior will occur again in the future under similar environmental conditions. Both models heavily focus on the influence of environment on a behavior. Important points to take note of are that all behavior can be modified using reinforcement and punishment. These models focus on the purpose of science and how they further scientific knowledge by using description and observation. The behavioral and psychosocial model focus on using observation and quantifiable data to support all of the interventions that they do. Lastly, the behavioral model has 4 functions of behavior: attention, automatic, access, and escape. These can be identified using functional analysis or functional behavioral assessment.
And now I will discuss point by point the points of the medical model. Autism was first identified by Leo Kanner and Hans Asperger in 1943. And Kanner observed individuals who displayed behaviors such as engaging in self-stimulatory behaviors, engaging in tantrum behavior when their routine was disrupted, and not displaying disruptive behaviors when the individuals were observed playing alone. Kanner identified these atypical behaviors as autistic, which literally means autos, meaning self, so selfism, to describe the inward behaviors associated with autism. So Kanner hypothesized autism as an innate disorder because he observed that autistic behaviors ran in families that he observed. So in the beginning, observing and describing different symptoms and treatments for autism were based on the medical model because it was thought that it was an innate disorder. Today, we know a little bit more about autism than we did when it was discovered and described by Leo Kanner. According to Krasden in 2000, Psychologists today know autism is a difference in the way that the brain works. That is, the brain of a person with autism develops and functions differently than the brain of a person who does not have autism. Due to the fact that we know autism is a difference in the way that the brain works and functions, it's essential for us to analyze biological factors in order to better understand the brain mechanisms that are underlying the various neurological differences that exist in individuals with autism. Furthermore, according to Zygmunt in 2012, the medical model provides clear and precise data in regards to diagnosis and treatment. And according to Shaw and Mountain in 2012, the medical model uses quantifiable data to diagnose and treat autism, which provides the public with clear and precise data related to autism.
Now I'm going to talk about the psychosocial behavioral models, Kruger point. And according to Spielberger, behavior is learned and can be modified. Nearly all behaviors can be modified using the principles of reward and punishment. The children can learn appropriate and inappropriate behaviors by not only watching others, but by the consequences attached to those behaviors. If a child is rewarded or reinforced for an appropriate behavior, you're more likely to engage in that behavior again. Now, however, if they're punished for an inappropriate behavior, the likelihood that they would continue this behavior is decreased. When determining how to best help change a behavior, you must look at the three-term contingency mentioned earlier, the antecedents, behavior, and consequences. So when you are adequately identifying the antecedent and consequences, you can then determine what are the functions of the behavior. And then once you determine what the function of the behavior is, you can provide the appropriate reinforcement to change that behavior. When dealing with children with autism, this may take many, many repeated trials, but to adequately change that behavior, you do need to make sure that the appropriate data is being taken. The data is imperative to determine the effectiveness of your treatment.
I'm going to talk about the medical model's primer points. So the first point is observing and describing different symptoms and treatments. The medical model is one of the oldest models. It has the ability to observe and describe different symptoms and treatments. As stated before, Shaw and Mountain of 2012 explain that it uses a scientific method which allows for it to examine and determine treatments for symptoms. It uses factual data based on information to determine these treatments. The medical model allows for individuals to be looked at and compared, and these differences can be looked at through the brain with multiple individuals with multiple different disorders. You can compare the normal and the abnormal differences. It uses quantifiable and empirical data, so the data that's taken is numerical and considered quantifiable. They rely on hard statistics and facts that are produced through numbers, and that allows for outside individuals to better understand the data and feel that it is reliable. So if you have a piece of paper in front of you that have numbers on it and explains what's going on, it's easier for someone who isn't in the field or doesn't understand to actually get what's going on and compare numbers, instead of just having to simply look and observe someone and look at their symptoms and try and figure out what's going on. There are clear and precise explanations. So the data that is found allows for clear and precise explanations according to an article by Zygmunt in 2012. These can contribute to a further explanation of the disorder or disease as well as treat it. It also explained that these explanations allow for others to further research the treatments and cures for the disorders. Lastly, medicines and treatments are given because there can be an exact diagnosis. So when there's an exact diagnosis, it allows for the medicine to be given that can oftentimes prevent, treat, or cure the individual. In the cases of an individual with ASD who needs vitamins or supplements due to lower levels found in them, the medical model has the means of looking at hard data to determine those abnormal levels and compare them to the appropriate levels in other people and know exactly what they're missing and what they need added to their diet or to help them fully function. Given that extra vitamins or supplements can help improve symptoms, so even if they're having behavioral symptoms, if they don't have the supplements or the vitamins that they need, they may not fully be able to function as they should.
These are the psychosocial behavioral models attacker points. While the medical model does provide many great benefits for children with autism, there's still many areas of concern. They have determined that there is a difference in the way the brain of individuals with autism works compared to that of typically developing peers. And because of that difference in the way they work, that should help us understand that there should be a difference in the way they learn behavior as well. And also help us in how we can help them change their inappropriate behaviors. The behavioral model uses observation and description, just like the medical model does. Observation and descriptions are used to describe the behaviors that are important and that may need to be changed. So in addition to those observations and descriptions, they're put together to form an operational definition. And that in turn allows us to move forward with the intervention. Specifically, those observations and descriptions are used to describe behaviors that are important that may need to be changed. Additionally, we use quantifiable and observable data to track our observations and behavioral changes. And that's according to Cooper, Heron, and Heward. That allows us to see if our interventions and changes in the environment are having an effect on the individual. So this can be seen in the form of an FBA and an FA. So this data is continuous as to help the therapist ensure that they are not implementing or continuing an ineffective treatment, as well as discontinue an effective treatment. But in response to the point regarding the benefits of medications, I agree that medications can be beneficial, but there's a lot of instances in which children can be over-medicated, and that affects their functioning level. In a similar way, if there's issues with maybe the way a prescription is filled, especially if it's liquid and has to be mixed, sometimes if it's not mixed properly, that can alter the functioning level of an individual. And I've seen that firsthand many times. So it was also mentioned that physicians are able to make an accurate medical diagnosis. However, there are many symptoms that are shared with many different medical diagnoses or many different medical issues, and that can result in a misdiagnosis. And lastly, what the medical model doesn't take into consideration are those environmental factors that the behavioral and psychosocial model is based on. There's many different medical diagnoses, such as type 2 diabetes and OCD, that are directly related to the environmental and behaviors of that individual.
Okay, these are the medical model's attacker points. So the psychosocial and behavioral model definitely has many good points. Having an operational definition helps to make a better understanding for the problem at hand, and without it, it would be very difficult to understand what behaviors you're actually observing. However, you can't simply assume that only using reinforcement or teaching a new behavior will completely solve the problems of the original behavior. Changing a behavior for a more appropriate one will always help in some way, but who's to say that that's enough? If a child has ADHD or seizures or any kind of vitamin deficiency, such as cerebral folate deficiency, you must use some form of medicine to help treat or prevent or cure those problems. If the deficiencies or behaviors are not treated with medicine, the new behavior may only help for some of the time, but usually that behavior eventually turns into another behavior. In response to the point on over-medication, In order to help individuals with any of the former problems stated, medicine is needed, of course. Some people do think that children are often over-medicated, and I can't say that I don't believe that. I definitely agree. However, the medicine that helps individuals is usually far more beneficial than the doctors who happen to over-medicate children. The FDA is constantly approving new medication as well that are similar to older ones with better effects to help downsize the amount of medicine that a child needs. I know that a lot of seizure medicines, the new ones that are coming out, they also can be used as mood stabilizers, and they keep individuals who need a mood stabilizer that also have seizures from needing to take 2 different medicines, and instead they can take one and it kind of does the same in one dose. In response to the medical model not looking at environmental factors, oftentimes many doctors do consider the environmental factors when looking at individuals and their diagnosis. Doctors will explain that there is a need for outside factors to change in order for the individual's health to improve overall. Many therapies that people are encouraged to use, such as cognitive behavioral therapy, are also still paired with medicines to further the treatment of an individual. So a doctor is looking at the fact that they are doing something in the environment or in their environment to change their behavior, but they may also feel that medicine is needed. Cognitive behavior therapy is a treatment that works on looking at a relationship between thoughts, feelings, and behaviors. On worrywisekids.org, there's multiple examples of how children with anxiety disorders used cognitive behavior therapy as well as pairing medication to see the children usually or fully see their potential of success. The same way a doctor will explain to a diabetic that they must change their lifestyle in order to ensure better health. They're looking at environmental factors. And lastly, in response to medical misdiagnosis, they definitely do happen, but so do behavioral misdiagnosis. It's easier to use quantifiable data to prevent a misdiagnosis than it is to use qualitative data. However, as stated before, operational definitions do help with qualitative data and are also still used by the medical model. The behavioral model needs something other than a behavior change or environmental factors for it to be used to its fullest potential.
So going back to the psychosocial and behavioral model, I want to bring up the point that you had previously brought up in regards to misdiagnosing in the behavioral model. As previously stated, there are 4 functions of behavior: escape, attention, automatic, and access. Therefore, misdiagnosis comes at such a lower percentage than that of the medical model due to the sheer amount of diagnoses one can have in the medical field. In addition, behavior is often maintained by more than one function. Therefore, misdiagnosis is not necessarily occurring, but rather not identifying all of the maintaining consequences. Moreover, one of the first questions asked before engaging in an FA or an FBA is if there's a medical reason for the behavior. Behavior can be maintained by automatic reasons. This can occur for a multitude of reasons, but some of them are side effects of medications, over-medicating, or mistreating a diagnosis. Persons with autism can be treated for a medical reason that is actually a behavioral concern that is maintained by automatic reinforcement or attention. For example, a child who makes themselves throw up after eating. A doctor might diagnose them with an eating disorder or acid reflux. However, an FA might be done and the function of the behavior might turn out to be automatic or attention maintained, and an intervention could be developed for these specific functions, and he or she may have their throwing up behavior decrease significantly based off of this intervention. And some final thoughts for you to take with you is It's important to look at all of the environmental factors when considering a diagnosis. What in the environment can be contributing to the behaviors that you're seeing? What can be maintaining the behavior? These are important questions to ask yourself. Without these questions, you're only considering the so-called internal factors that you have no observations of. However, using a functional analysis and observable and quantifiable data, you are able to make a decision based off of facts. Although both sides agree that there's no cure for persons with autism spectrum disorder, the medical model would have to agree that there's no medications that are proven to treat autism either. Applied behavioral analysis is the only proven treatment for a person with autism spectrum disorder. A diagnosis alone has never improved a child's life. However, ABA has proven time and time again to be effective in improving the quality of life for an individual. Applied behavioral analysis provides empirically based interventions and treatments to benefit not only the lives of individuals with autism, but also their families.
On the medical model side, in order to salvage our arguments and make some concluding statements, I'd like to point out that we know autism is a neurological difference. So the brain of a person with autism develops and functions differently than the brain of a person who does not have autism. There are various studies that have noted different developments in different areas of the brain in comparing an individual with autism to an individual who does not have autism. There are no cold hard facts that following either the psychosocial behavioral model or following the medical model leads to a cure for autism, as she has also mentioned. But the data that is taken through using the medical model is quantifiable, which gives us real concrete statistics that can be easily understood and applied in this field. It's easy to use quantifiable data to prevent misdiagnosis. It's easier to use quantifiable data to prevent misdiagnosis than it is to use qualitative data. Also, there are only 4 identified functions of behavior, as she talked about: the escape, attention, automatic, and access. And while on the other side, there are endless biological functions that could attribute to specific symptoms or behaviors. So therefore, discovering the biological function of specific symptoms or behaviors would be more on point with the root cause or function. The behavioral model needs something other than behavior change and environmental factors for it to be used to its fullest potential. The medical model often considers external environmental factors in diagnosing and treating issues, but its main focus is on the internal root cause of the issues at hand. Again, there's no known cure for ASD, autism spectrum disorder. Therefore, it's beneficial for us to continue to explore the medical model approach to autism. Exploring the medical model is invaluable to us at this point, especially with the known brain difference that exists in individuals with autism compared to individuals who do not have autism. Due to the neurological difference, it's important to look at internal factors in diagnosing and treating ASD. Searching for biomarkers in individuals with autism could lead to earlier detection, more precise causes, and more beneficial treatments for autism spectrum disorder. Many internal issues can be treated at their root with medicine or medical practices. Overall, based on the knowledge that a neurological difference exists in individuals with autism, I think it's imperative to continue to use the medical model to explore diagnosis and treatment of autism spectrum disorder. Now, the debate between the medical model and the psychosocial behavioral model for diagnosing and treating individuals with autism is a very difficult debate because neither side really takes into account all aspects that are needed to make a diagnosis or to effectively treat an individual with autism. Both sides obviously bring about great points, but it seems that neither side takes in all aspects in order to carry out these things in making a diagnosis or effectively treating an individual with autism. So this also brings about ethical concerns related to both of these models.